Assalamualaikum warahmatullahi wabarakatuh. Good morning and good afternoon, everyone. Welcome to PAM Online Series. This is a special online series conducted by PAM in association with Arcasia. It's about Arcasia COVID-19 guidelines, co-inventing built environment, the way forward for PAM. Back in May 2020, when cities and countries have started lockdown from COVID-19 pandemic, work from home and study from home became a must to do for large groups of urban population. However, other groups of population suffer from the work from home and study from home are not viable options. They either have to go out to work or cannot work at job, and all are jobless, which means no income. ACSR, Arcasia Committee on Social Responsibility, and AEA, Arcasia Emergency Architect members, who represent Arcasia 21 members countries, also worried about the difficulties member architects encountered. To understand the early impacts of reaction, we sent out a survey in early May. So this is the result of it, and this is the outcomes of the program. And this is now the action plan for Arcasia passing the baton to PAM. So before we begin the conference proper, I would like to have Architect Saifuddin Ahmad, who is our past president on Council of PAM Council in Malaysia, to give a few words. But before that, I will give his biodata. Architect Saifuddin bin Ahmad, Diploma in Architecture, University of Malaysia, Bachelor of Architecture, Deakin University, Australia, and he is also part of SNO Architects Berhad, a director. And Architect Saifuddin is a fellow of Pertubuhan Architect Malaysia, registered ASEAN Architect, APEC Architect, an honorary member of Australian Institute of Architects, Association of Siamese Architects by Royal Patronage, Council Member Alternate for Region 4, the International Union of Architects, UIA 2017 to 2021. Vice President of Zone B, Arcasia 2019 to 2021. Past President on the current Council of Pertubuhan Architects Malaysia 2019 to 2021. So without further ado, Architect Saifuddin, the floor is yours for the welcome remarks.
Thank you, Mus. Assalamualaikum and very good morning. I would like to thank the PAM Committee of Social Responsibility for inviting me to give an introductory speech. Firstly, a short introduction for those who are not familiar with Arcasia. Arcasia, or Architects Regional Council Asia, was established over 51 years ago, and PAM is one of its founding members. Currently, we have 21 member institutes, and we are divided into 3 zones, A, B, and C. A consists of institutes from South Asia, B, Southeast Asia, and C, the Far East. On the subject of COVID-19, I feel is most appropriate, though there have been many talks and seminars on the subject. Since the COVID-19 was first discovered about a year ago in Wuhan, China, it has spread throughout the world, and countries started lockdown back in May. Arcasia, under the purview of the Arcasia Committee of Social Responsibility and Arcasia Emergency Architects, has initiated 13 Arcasia COVID-19 guidelines for built environment intervention. And a webinar was successfully held last month. Arcasia Office Bearers meeting that was held last month has also approved the guidelines and is now distributed to all member institutes. As such, I would like to congratulate PAM Committee of Social Responsibility for taking the next step on how PAM can adapt these guidelines to suit in the Malaysian context. The 2 key people from Arcasia, member institutes who were responsible for these guidelines, namely Architect Tony Wong from Hong Kong Institute of Architects, Architect Thana Chirapiwat from Associations of Siamese Architects, are here to share with you their views. Enjoy their talk and stay safe and take care. The pandemic is still not over. Back to you.
Thank you very much, Architect Saifuddin. Next, I would like to invite Architect Russell Dadinia from Sri Lanka. Before I pass to him, I would like to read his biodata. He is actually the current chairman for ACSR, Architects Regional Council of Asia, Arcasia. And he's currently the principal architect of Russell Dardenia Chartered Architects, RDCA, director of RDC Architects in Sri Lanka. Russell serves to the SLIA Council more than 10 years. So without further ado, Russell, the floor is yours.
Thank you, Kamal. Good morning, dear members of PAM, friends of Arcasia, friends in Arcasia, ladies and gentlemen across the region. Let me thank first for the kind invitation by PAM for this wonderful webinar today. I think I should not introduce what ACSR and what we are doing for you to make interest and specifically to explore people around us to inspire and establish serving to the community as our prime responsibility. You will all realize as its original spirit at the end of this program. Arcasia committees are comprising with ARCIA for education, ACGSA for green and sustainability, ACYA for Young Architect Forum, and Fellowship Committee for those who are attending Arcasia meetings physically. ACSR in particular for Arcasia social responsibility projects. I would say very important committee this time and era. We can see how best architect fraternity can serve and extend helping hands to the needy, to embrace with community with tangible action plans. We, Arcasia, wanted to make 2020 a remarkable year with series of webinars with able overall coordination by our ever-shining VP, Zone B Saifudi. And I would like to recall our Madam President, Rita So's clear directions. She decided to touch upon 4 key thrust areas during the pandemic to make all our attempts in focus, which was endorsed by Arcasia office bearers and committee chairs for implementation online series of attempts. Preparedness against emergencies of pandemics, life after 2020, a new normal, empowering our communities, a new future, a new mindset. I think almost all areas are more focused and in relation to the Arcasia Committee on Social Responsibility. We can do wonderful series of tangible projects under any theme if we are thinking really loud. In response, we quickly formulated Arcasia COVID-19 Task Force with AEA, Arcasia Emergency Architects, is our official assisting arm for emergencies. The Director Tony Wong is here with us today to present with Dr. Thana from our committee as the convener of formulating these guidelines. We launched research-based study during the pandemic by staying live and strong to formulate regional guidelines for public and private domains to ensure health, safety, better planning, better environments to redefine our future built environment. Great efforts are always bring us great results. We managed to formulate 13 ACGs. Probably we are going to have a thought-provoking deliberations on those guidelines today to share ideas, knowledge dissemination, and model the way forward for implementation. The way forward of PAM on co-inventing built environment at its inception is wonderful, as their core responsibility as institute through the CSR arm of the PAM. It's amazing initiative, I would say. It's delighting me and our ACSR and AEA committees so quick and timely response from your end. I remember when we were discussing our implementation plans across the region, how and when, in our weekly task force meetings, Architect Novina suddenly expressed, PAM is ready to do this webinar. So quick and proactive response. Let me congratulate PAM, Novina, and Architect Mumtazah Mustajab, CSR chairperson, for this very first awareness program of exploring implementation these guidelines in Malaysia. The collective effort to find solutions to the current situations we all are facing has provided us with a multitude of options. We have learned to draw from the collective knowledge and experience of others across Asia in order to overcome the issues we have been faced within our own home nations. I truly believe the spirit of camaraderie is what Arcasia stands for. Now, we are unfolding our spirit via action plans and exploration of these guide plans to suit the cultures, contexts, and people across our region. As we open up today's proceedings on an exemplary productive webinar, I'd like to reflect on the effort of the AEA and the ACSR committee over the last few months. I had the privilege of engaging in many Zoom meetings, emails, and numerous WhatsApp conversations with a dedicated team of architects from across Asia. It gives me great joy and pleasure to see the initiative taken by Arcasia COVID-19 Task Force several months back bear fruit in the form of 13 guidelines, which we are going to represent in today to the very first country in response. Thank you, CSR Chair Mumtazah and PAM once again for their great initiatives. This webinar would certainly help to make awareness towards fine-tuning these guidelines even further levels in collaboration of the inputs of the participants and wider spectrum of stakeholders online, discussed and agreed to the next level of implementation. At this juncture, I wish to thank the resource people who are very graciously joining in these efforts, Architect Tony, Architect Thana, and Architect Mumtazah, and Architect Mustapha Kamal will help you all to introduce these guidelines. How we should implement these in outset. We are waiting the great results and outcome from able and inspiring team of PAM in Malaysia in near future. Thank you very much.
Thank you very much, Architect Russell. That was great, and also for Architect Saifuddin, for both of you to set the tone for this morning's webinar session. Now we go into the conference proper. Myself, Architect Kamal, will actually introduce each and every one of the speakers in their order of appearances so that we can have a smooth flow of ideas and also the discussion this morning. So I would like to explain and also to describe Architect Tony Wong from Hong Kong. Tony is a registered architect and a seasoned corporate real estate and facilities management executive with experience managing and multidisciplinary international teams to deliver real estate projects and services to meet business results. He's now currently the director of Arcasia Emergency Architect. So he has been in this business for 30 odd years, and he had also sit on many boards and also committees, especially during this COVID-19 period. Next is Architect Dr. Thana Chirapiwat. Is currently an assistant professor and chair of urban and environmental planning program at Silpakorn University, Bangkok. He graduated with Bachelor of Architecture degree from Silpakorn University, Master of Science in Building Design from Columbia University, New York. And his other various accolades has also made him an able person to actually guide us throughout this whole ACG's program. And the last is Architect Mumtazah Mustajab, the MD of and founder of Artisphere Sdn Bhd, council member of Tuban Architect Malaysia, and specializing in special needs design consultancy as well as education institution. And she chairs the current committee social responsibility as well as the emergency architect in Tuban Architect Malaysia. And so without further ado, I pass the floor to Architect Tony, then later will be Dr. Thana, and next will be Architect Mustapha. The floor is yours. Thank you very much.
Thank you, Kamal. Can you hear me? Okay, good. Thank you.
Yes.
Can you help me to present the slides, please? Yeah, thank you. First of all, thank you very much, FAM, for inviting us. This is the first time we do what I would call a roadshow. Hopefully explain to you not just the guideline itself, but the purpose behind the guideline and how we foresee it's going to happen, how we would like to see it's happening in the region. Next slide, please. So let me tell you a story. It all started with a question. So Russell contacted me saying that, what can we do about it? So I said, I'm thinking about it the same thing as well, because I was the director of AEA, Arcasia Emergency Architect, and that is actually the very thing that I was thinking, we must do something, but what are we going to do? We don't know. We did not know what we need. We did not know what can we do. There are a lot of guidelines sitting outside there. They're all, we need to understand what is outside there. So what do we do? Next slide, please. So we sent out a questionnaire to all our members institute seeking comments. So these are the 8 questions set up. So it's a big variety of questions because we actually didn't know what is important, didn't know what people are interested in. So we have these 8 questions. And so not surprisingly, but we actually get very enthusiastic results, except one institute have come back to a response, and some particular PAM has a lot of feedback coming back. So I'll show you some examples of what they are. Next slide, please. So this is question 3, for example. So we even have quantifiable results for many of those questions because we can see the reoccurrence of certain subjects. From this one, you can see that a lot of them actually are involved in doing relief work. A lot of them, the responses are actually writing guidelines already, right? And some are actually doing community initiative. Actually, we are contributing back to the society. So that's kind of interesting. So it's not just technical. COVID-19 is not just technically architectural matters. It matters to a lot of different things. So that's one thing we learned from that. Next slide, please. And also, we have got a lot of verbatim from many people that in this questionnaire. PAM, you see the PAM one? Okay, so we got information is what we're looking for, right? So, and that's triggered ourselves to start sitting down and think about what are, with all this information we collected from the members, what should we do? So we had a meeting in which these questions and results was shared with all the member institutes. That was happening in early May. So that was a first engagement meeting we have with all the institutes, and we got a lot of feedback in that meeting itself as well. And it goes back to the team itself. So next slide, please. What we do is that think about what are the things that we can do to be most effective and encompass most of the things that our members are thinking we should be doing. Right? We got a good idea now after all these meetings and questionnaire. So we decided that we need to draft our own guidelines. Reason being that this is what our members are really looking for, some guidances, some alignment. And also, when we start looking at the other guidelines, we found that many guidelines are very specific about certain aspects of the COVID-19. Some, for example, the WHO, they are looking at different kind of facilities, but they all drafted by different people, very different. And the way they formatted, the way they approach things are different as well. So even the world-known organization, there are plenty of guidelines floating around, and there's not a lot of consistency there. So what we decided to do is to draft our own guidelines, and Thana and the team actually put together a framework for that, which he's going to explain later. So it's encompassing public-private domain, encompassing current and future, also covering not only architects, but also policymakers and people in the general public. So that's a very comprehensive kind of approach towards that. And so we actually did a lot of research into guidelines. So some 12, 13 architects got together, and we all separated our duty, and we looked at almost like 20 guidelines all over the world and look at what are the commonalities, what are the things we can learn from them. So we did a summary. This summary, of course, can be shared. I mean, I can provide that link to to PAM for you to take a look at all those research results. And very interesting. But that's not enough. Looking at the guideline itself, we don't think that we can only read it through the eyes of architects. So we consulted a panel of experts. There are medical professionals, there is city planners, there is a policymaker from architectural scene, and also from a heritage architect. And with their collection of their expertise, together with our research guidelines, we prepare a draft guidelines, which come with a workshop. So that workshop was held in the 12th of September. And then, of course, of those feedback, we did a substantial revision of the guidelines because there's so much feedback, and once you put it out, you understand that this is a bit clumsy. The initial one was very clumsy. So we did revise one down to the 13 ACGs. And so with a forum in November, and now at this stage, the ACSR guideline is now being finalized, and we are going to implement it in the countries. So let me go to the next slide. This one actually shows you the timeline. So it was covered before. So in June, July, we actually did a lot of research work, right? And July and August, we start writing the guidelines. September, we did a workshop. September, November, we revised the guidelines. November, we had a webinar again, and now we're publishing the guideline itself. So what's going to happen next? So what we want to do is to explain to you why is this important. Next slide, please. What's unique about the 13 ACGs? Number one is actually the co-creation. This is why we call it co-inventing built environment, not one person's work. If you think about the team of people working on this, we had 3 meetings: engagement meeting, workshop, and a webinar in which we all receive feedback. So we're all putting effort into this together. And now the next step is that this is book 2 about the guideline. Book 1 is the general direction. Book 2 is now for local to adapt, not only adapt, but give us the detail, give the relevance to the local situation. Number 2 is comprehensive. So we did not look at just architecture. You see, Thana's going to explain to you what those guidelines are later on. But you see that it's not just about physical space planning, not just about medical facilities, not just about technology. We're touching upon things like procedures, talking things about the general culture. So we try to make this a comprehensive guideline because we know that COVID-19 is not able to be cured simply by architect-putting effort. It's a collaboration effort. We need to work with other professionals to do the work. So therefore, it has to be comprehensive so that architects will understand what it takes to achieve success and be able to listen to other experts' help. Number 3, the guideline as it stands out is directional. It's a framework, but there's a lot of research behind it. So there are information available from this group of researchers and from this group of task force, and we're ready to share with you and discuss with you. Of course, we can put it all out, but then you have to spend time really reading through all those work. It would be a double, replication. So I don't think it's necessary. We can always work with you. So last but not least, we actually have a very strong intention to make this guideline something that works. That's going to create change. So it's not just finishing the guideline and that's it. You can read it to wherever you like with it. No, we don't want that. What we really want to do is to work with you and see those changes, because a lot of them involve people like policymakers, and they will not listen to us. We have to find a way to make sure they listen to us. Talk about educating the public. They will not listen to us either, right? So we have to find a way to educate the public as well. So there's a lot of work to be done here. Next slide, please. Basically, this is what I presented before, but what I want to show it to you again is that to demonstrate the point that I was just making, it's not just an architectural thing. If we want to deal with COVID-19, we need to understand the basic principle behind it. So these are the 4 basic principles I shared before. Number 1 is that contain the spread. Number 2 is to make sure our system can support it. Particularly, I want to point out the vulnerable population, because in my role as a corporate real estate facilities person, I've been dealing with emergency management for many years. And we know that the thing we need to protect is the most vulnerable, highest risk, most vulnerable population. And this is precisely what ACSR has been trying to do, social responsibility. So number 3 is we still have to make a living. So this is a long drawn exercise. So we have to make sure that we can maintain certain activities. Last but not least, the social economic impact of this is huge, as you can all see now. And so therefore we need to think big as well in this guideline. That's why the guideline is comprehensive. Next slide, please. So of course, obviously this scope, there are limitations to this, right? This is intended for the built environment, right? So we actually have to base on other experts' advice on what should be done about their area of expertise and what each country is trying to manage their own situation. So therefore, this is only a set of general guidelines, but then we would urge you to look at what your local experts and international organization is publishing to follow that. So number 2 is for adaptation. We always keep saying there's book 1 and book 2. So we finished book 1. Book 2 is going to be written by the 21 countries, right? So I hope this is the next step that you can do it for the good of your own country. Number 3, again, we need to call it out because all the things we talk about, even the 4 principles, there are conflicting requirements in all the principles behind. So you can always put in the risk-free environment, but the risk-free environment means that you soak yourself in alcohol and not alcohol, I mean the sanitizer, and then you kill yourself. You can't do that, right? So you must balance between the risk-free environment versus social costs, economic impact, and also whether it's sustainable or not. Next step is the practice-related issues and also things that are beyond our control cannot be considered here because this is intended for making change to the built environment, not to the architect's profession. And also, if things are purely beyond our control, some of the economic matters, it's not within the built environment. So we are not also ignoring those things. Last but certainly not least is that we are going to make sure that we have an implementation plan. So this is the first step that we're going to do it. And hopefully with working with you, PAM, and also the other institutes, we'll be able to make some meaningful changes to the built environment. Thank you very much.
Thank you very much, Architect Tony. That was great to have you say the ballparks, items and so points of this program. So next we go for Dr. Thana for the detailed explanation. Thank you.
Okay. Hi. Good morning, everyone. And thank you, Pam. Very proactive institutes among the Arcasia Institute members. Thanks, Saifuddin, for the intro, and he's been the kind of the key person who connects the ACSR, the committee, to the Arcasia office bearer to get the approval for the our guideline, so that it's kind of become the mechanism that we can drive the institute, individually, as Tony mentioned, that the next step is to go into the country level. Our guideline just giving the framework and the kind of pointing to the points where should be concerns. And may I have my slide, please? Yeah, so that we have been working for the COVID-19 task force has been working for 6 months, as Tony mentioned from the beginning in May, and we have been meeting weekly every Monday evening, continuously, non-stop, up to now. And then, not that we finished yet, we still have work to do. And the more important thing is the implementation and how to make these guidelines, the broad points to do become the thing that actually our members, architects, and also our member in the society taking points from this guideline and doing something to improve the environment for healthier and more safe environment for the individual and also for the mass, for the public at large. Next slide, please. So I see that now we have over 100 attendees. You can capture this screen with the QR code. This code gives you a link to download the latest draft of the guideline. To see this green cover, and also the guideline we have, the detailed points and some graphics that we show here. This is the guideline that we updated after we had the last webinar that get input from the broader groups, and I also I was informed that the audience today, not only architects, the member of PAM, but also might be some attendees from other fields like medical field or policy makers, engineers, and maybe city planners. So yeah, please download this guideline and have a look, and you can kind of make detailed understanding of the guideline, and later, specifically for PAM member, work with PAM, with Mumtazah, the chair of the PAM's Social Responsibility Committee, to work out the detail on how to actually implement in your local context. And the local context become the important factor here. Next slide, please. To give you a broad overview of the guideline, the 13 guideline include what's shown on this screen here: space planning, building technologies, adaptation of environment, flow management, communication and education. This start to become beyond the architecture or built environment, and start standard operating procedure, resilient contingency planning, which is a kind of preparedness for other pandemics in the future. Medical and healthcare facilities, this involve the medical profession, and also involve the infrastructure program for the city to manage. Number 9 is building regulation and review. Number 10, city planning and urban design review. This also extend to involve the regulations and code, and in the future, we believe that building codes and city planning land use code will evolve to respond to the pandemic factors. Number 11 is health and well-being. This is kind of setting up the environment for, or the lifestyle for a sustainable living in society in the urban environment. Number 12, socio-cultural aspect. This is important item that was raised after we had the workshop and the webinar. People start to be concerned about the guideline that they have seen around might not fit to their specific context. And here we also, not only the socio-cultural, that means the way of living in the different community, religion practices, and also the economic context, plus the climatic and geographic context that need to be integrated into the guideline and the way we implement and to rebuild the built environment that we live in. Number 13 is urban and rural migration. I think we have been seeing the flow of people moving basically away from the dense city. But as we learn from the panel expert that we invited to participate in our workshop and webinar, we say that the urban area kind of lost the workforce. Many people move out from density and seeing the density as the problem. But I think we learned from the city planner that density is not the problem. Density is good so that you have access to services, but the crowdedness is the problem. So we need to manage this kind of urban and rural balance between these two environments. Next slide, please. And as Tony mentioned, we try to make this guideline to be comprehensive so that it expand, covering different level, different scale of environment, from home to neighborhood to the city. And in home, in neighborhood, in city, we also have these two domains: private spaces, private places, and versus the public spaces. And so the guideline, if you download the draft guideline, you can see we also identify what to do in the private domain, what to do in the public domain, and also the space, the intermediate space, the transitional spaces between the private and the public also are covered in our guideline. And the next dimension is to cover the broad range of stakeholders. Initially, we think about the guidelines so that help architects to be a productive member of the society. And then we learned that the guideline cannot only aiming for the use of the architects and the policymakers, the planners that involve how to manage, how to arrange the spaces in the city, especially the public spaces, and also might go up to the rule and regulation for those locales. And also the general public should be able to benefit from this guideline as well. And the last dimension that we cover in the guideline is the implementation stages. We have the short-term recommendation and also the long-term recommendation. Next slide, please. And to give you some kind of visual, so I kind of put together the kind of relationship between the 13 guidelines that you see on these boxes. These are different guidelines, and then we have public and private domain. So we can look at the guideline that concern recommend things to do in the private spaces, either home or offices, and also the public, either communities center where people share the space to use, and also the open spaces and public spaces. And then this is the built environment, neighborhood, home, and the city. So that our guideline, if you look into the detail, we cover this, and also we provide the short-term and long-term action plan to deal with different environments. And lastly, the stakeholder, architects, public and policymaker can also look into. So different guidelines might emphasize the role of different stakeholders, but overall, these all apply to all stakeholders. Next slide, please. Okay, come to the important part of this session. So now we move into the implementation stage. Immediately after the webinar, which is our last public activities, Tony has already sent the presentation material, the draft guideline to all the participants who register in our webinar, and also send this to the Arcasia Member Institute, hoping that they have time to start to understand the guideline and seeing ways to implement them. Then we already, as Saifuddin mentioned, we already get endorsement from Arcasia office bearer. We now editing for the final publication for the guideline, which should the revision should be done by the end of this year, which is the end of this month. Next slide, please. And then we should be able to launch the final publication in January. It can be in the form of ebook that people can download, and also in print that the institute can maybe print on demand as many a copy as they needed. And then we start to go on the roadshow. And with PAM today is our first roadshow to deal with the individual institutes. So we plan to do the roadshow with the institute during January to June this next year. The aim for the roadshow is to create the understanding of these 13 guidelines, and also obtain commitment from the institute to adopt and roll out this guideline with the development of the detailed local guidelines for architects and policymakers and the public as the local context. And Also, we also seek examples from the local institute, so that the second booklet that Tony mentioned will be the one produced by the local the institutes, should be also with the local example to show exactly what to do, so that this will be benefit to the general public and also the vulnerable groups that need to, you know, to see in more detail and more realistic implementation. And also we hope that the guideline, these 13 ACGs, can be translated into local languages throughout the 21 member countries. Next slide, please. So the implementation will be the kind of the process for the co-inventing that we started out our roadmap for the guidelines. So as Arcasia, the institute, I think we will try to develop online platform so that members, institutes, and also the member of the institutes and also the public can share and exchange and communicate these guidelines and showcases their implementation, so that this can be continuing activities that the 13 ACG roll out and develop furthermore. We should ask the member of the institute, you know, our audience today, to help expanding the network, to connect with other stakeholders and bring them in to get involved with the rollout of the implementation. So the first wave that we aim as the ACSR and the AEA, the Social Responsibility Committee and the Emergency Architects, we will selectively pick the countries or the institute with the most proactive member possibly. Malaysia is now the first one, you know, the most active one, and the Malaysia PAM is also the kind of the founding member of Arcasia. So PAM has been proactive throughout 50 years of Arcasia, right, Saifuddin? And also we got some responses from institute from Pakistan, India, Sri Lanka, Hong Kong, Thailand, Indonesia, and these are the countries that involved with our task force as well. And so that the early part of next year, we should be working with these selected countries member, and as we develop the kind of the momentum of the implementation, I believe that other institutes of our Arcasia will start to participate and increase their active involvement in this process. Yeah. So the last slide to show our PAM member, to see that Arcasia involved. Next slide, please. 21 countries, and these are, I think on this diagram, this chart missed only Bhutan. So that we have India, which is the oldest institute. They celebrate 100 years old, I think a couple of years earlier. And then we have ASA and other members throughout the Asia region. Thank you.
Thank you very much, Dr. Thana. That's very inspiring when you show the detail of the 13 AACGs. So just like we are doing for a 50-year flood cycle improvements, now we are doing to make the cities or even our nations and neighborhood to be pandemic proof of 100-year cycle. So that's probably the way that we should be going. So the next speaker will be Architect Mumtazah from Pertubuhan Architect Malaysia. The floor is yours, Architect Mum. If you could unmute yourself, thanks.
Yeah. Assalamualaikum. Slides, please. Salam. Thank you. Very good morning to everybody. Thank you for joining us in this webinar. Thank you, Dr. Thana. Thank you, Anthony, for the brief of the ACG. Next slide. So today I'm just going to brief everybody about what has been going on in Malaysia and what we intend to do. So we're all here trying to make something positive from a negative situation. Next slide, please. First and foremost, I would like to congratulate Arcasia for formulating these base design guidelines. So this is actually fresh from the oven. It's still really hot. And this is to be shared among all the member countries in Asia. It is not an easy fit to do, as there were a lot of discussions and ideas flowing and flying across the continent. However, COVID-19 pandemic has made online discussions the favored way to hold meetings, and even more so when everybody is far away from each other in their respective countries. It may take time to finalize the guidelines, but it works so far. So congratulations again, Arcasia. Now these guidelines have actually arrived in Malaysia via PAM. And as you know, just now, Tony has shared the QR code. So it is now our role to localize the guidelines, to Malaysianize it, to suit the Malaysian environment, the Malaysian condition, using the existing Malaysian laws and parameters. Next, please. So, click. During the start of the pandemic, sometime in March 2020, PAM faced several challenges, including having events, activities, and meetings that are being cancelled or postponed to uncertain dates. We were all very concerned and all kept track of what is going on around locally and globally. Luckily, PAM CSR has a very positive and forward-looking policy to ensure members' morale and hope remain vigilant and up to safeguard the country's interests to combat a condition that has yet to settle now, even now. So since March 2020, PAM CSR had remained steadfast in producing exemplary design ideas from quarantine centers, checklists for appropriate quarantine centers, webinar series, and setting up of think tank group to work with the Ministry of Health Malaysia. The spirit remains high to continue with localizing of the ACGs, where PAM CSR is proud to be one of the contributors to its formulation. Next, please. Click. PAM continues to be active despite the lockdown or the Movement Control Order, MCO. So activities after activities, webinars after webinars were created, especially on issues related to COVID-19 health and safety, and of course the business of architecture. There were lots of discussions, ideas, suggestions being made along the way. Even our Director General from the Ministry of Health became one of our esteemed speakers, calling upon architects to look into the health of the built environment. Next, please. Click. Many other allied organizations too have their version of webinars related to COVID-19, re-evaluating, perhaps replanning and the reorganization of by the Malaysian Institute of Planners. Discussions on livability of the city, mental health of a city, roles of public spaces in times of crisis, geofencing system, and various other interesting topics. Click. The outdoor and the greeneries, and planning of the outdoor spaces for a healthier outdoor lifestyle, sowing the seeds of new ideas for the new normals into the design of landscaping. Especially now that we are dying to go out as frequent as possible, be under the sun, and be more appreciative of nature. So the Institute of Architects of Malaysia, the Institute of Landscape Architects of Malaysia too, have their series of webinars encouraging members to adopt the new norm in landscape design. Next, please. Our interior designers too faced cancellations, but that did not stop them to organize webinars responding to the impact of COVID-19 to the interior design practices. I am sure by now there would be more and more discussions on how the SOPs of COVID-19 impact on interior layouts and plannings. Next, please. Click. We've had the Malaysian Productivity Corporation's webinars on the impact of COVID-19 on various topics, too, including the built environment and fire safety design. Other than the built environment, they also discussed on how the COVID-19 impacted on the food supply chain, poultry industry, labor, workplace. So with all this new type of working attitude or working style, such as online discussions, online webinars, Food Panda, Grab Food, online registrations, digital transformation, this will have more impact on the design of offices, restaurants, public spaces, factories, and so on. Next, please. Urbanese recently held the Malaysian Urban Forum, and there were several topics related to SDG and COVID-19, such as on achieving SDG through the COVID-19 response in recovery, the impact of COVID-19 on low carbon agenda, integrating the new normal with SDG, and of course, there were a lot more ideas and suggestions flowing during the forum, which was held from 28th to 30th September 2020. Next, please. So, what's our strategy? Our strategy now is to compile all this information from the various organizations and their webinars, bring them along, get them to join us, and as I have mentioned before, using the Malaysian bylaws and Malaysian standards as the parameters, and of course the 13 ACGs, we create MyCG, the Malaysian COVID-19 guidelines for the built environment. Next, please. So MyCG guidelines, as advised by Dr. Thana earlier, so will have short-term measures as guide for designers and developers, and we hope our long-term measures can be included in our Uniform Building Bylaw, the Malaysian Standards, Planning Guidelines, Local Building Guidelines, the Urban Design Guidelines, and so on and so forth. So we also target architects and allied professionals, policymakers, and the public. Click. And we need to consider the private domain too, individuals, man, woman, and child, and spaces as opposed to the public domain spaces, be it indoor or outdoor. Next, please. Click. And of course, with the support of Arcasia and with the advice from various experts internationally, PAM, with the lead by PAM CSR, and we'll have all the PAM committees, as many as possible, various allied organizations, educational institutions, academicians, policymakers, governments, and local authorities. Let's all just join together. We create a task force, have a task, each one take up a task or a topic, and we combine. Next, please. So PAM's roadshow, click. We hope to target that we can finalize something by July 2021. So today is our kickoff, where we were being briefed by Dr. Thana and Architect Tony. And we will send letter appointment, invitations to all the MyCG members, and then disseminate information to them. Then we'll compile all the guidelines from the webinars, from notes, and we'll do a survey and data collection. After that, we'll evaluate and localize to suit. This will be a lot of things to do, putting them all together, digest them, and then we'll have the workshop. At every of these, we will need to have some kind of an output to see whether we are progressing well or not. We'll invite panels of experts to review, validate, and share more ideas. Then we'll have the editorial board doing revisions and finalizing the guidelines, and launch via forums or exhibitions or competitions. These are just a guide for us. So a lot of things may come along the way, and we hope a lot of people can join us in this. Next, please. So come and join us. Do contact us at PAM under the CSR committee at http://www.pam.org.my. And to join us, we would like you to download a Google form as written there. So we'll share it also in the chat and various other medias as well, and the PAM social medias. And click please. Yes, these are our various PAM committee members, PAM committees, the education committee who have expressed their interest to be a part of this team. And we hope there are more and more other committee members. So for PAM members, you can join any of these committee members to participate in our project. So you can represent these committee members. And we will also invite various other allied organizations, even the Ministry of Health of Malaysia, our local authorities, and institutes, engineers, landscape architects, lawyers. We even have some legal advisors who are actually interested to join us. We'll invite universities as well, of course. I'm sorry, Datin, I forgot to put in universities. And yes, definitely, we need the researchers, we need the brains to help us put all these things together. So we hope these guidelines would not just benefit us, but would benefit Malaysia and the Malaysians, the people in Malaysia. So Malaysia boleh. Thank you very much.
Thank you very much, Kitab Mumtazah. That's a whole mouthful of ways and things to be done. As you said, it's the passing of the baton from Arcasia to PAM as one of the institutes, and later we pass on to the other institutes. Okay, I think this is a good start. And before we go to the participants' questions, maybe I would like to ask one question, and later I would like to have this honor from Datin Wina, who has been the instrumental of the not just the back room, but it's actually the foreground of this whole thing, to give an overview of how whatever that Architect Mumtazah has said to actually entice and also attract people from all association, all allied to actually come together and work together on this, because this is another version of the SDGs, but it's become the ACGs of the Arcasia, and I think it is very, very crucial. So one of my questions is, I think there was one question which Architect Tony from Hong Kong had answered, but this will be very prominent in most of the countries in Asia, as we are actually a building nations and also a building region. So I hope any of you can answer this about the workers' quarters. You know, even though they are temporary, but it is actually mind-boggling to just think about it. Maybe I would like the answer from apart from Tony, maybe from Dr. Thana and also Mumtazah on this matter before I pass to Architect Mumtazah. Datin Wina, sorry. Architect Tony, your response, please, on that issue, even though you have answered it on the chat.
Okay, I thought you don't need me answer because I answered live on the Q&A. Repeating, and I think this is a $1 million question, because you can see from the news that some countries are doing so badly, and they are so-called Western countries who are very advanced, but they kind of control the people. Behavior is a big issue. So I think one of the things we need to do is that there's always a balance between encouraging people not to behave and prohibiting people from misbehavior. So there's always a balance between the two. Some are more successful than others, but what, objectively speaking, if you have more technology to help you to monitor the situation, you can, first of all, identify those who are actually contagious, and also you can let those non-contagious people to do their own thing. So I think one good example is the China's the health code. It's a good practice. Right. Obviously, I'm not hailing certain kind of political belief, but then so these are the objective way of looking at how we can balance between encouraging and prohibiting.
Dr. Thana, your response?
Yeah, I think when we kind of think about how the individual behaves differently, and how to say usually initial response would be like how we can control them, right? But I think as Tony says, like the kind of the measures on like carrot and sticks should be well balanced. But also I think we need to elevate the level of understanding and the awareness of how, you know, dangerous this kind of the virus and the spreading can be, how contagious this virus can be. And I think learning from what Thailand has been doing, and quite successfully, I can say, is that it's not that we fully rely on, you know, try to make individual to behave, but we manage them in such a way that the organization, you know, either the company themselves, the construction company, or the property owners, kind of implement the SOP, the standard operating procedure, such as screening process, like in department store, shopping centers in Thailand. They all have the staff to do the screening, the temperature screening, and also the kind of, with the technology help, we have the check-in on the mobile app, so that the government have the record of whereabout people are. But these are voluntary, you know, it's not 100% that you get everyone who enter the public building or the commercial building to register their appearance or entering or exiting the building. But I think it's kind of, we bring multiple tools and combine them to fit the behavior and also the way of life, the practices of, you know, the community themselves. So we need to understand how our people behave, and we cannot really tell, you know, Malaysia should do that, Malaysia should do this, but, you know, we adjust and adapt along the way. That's why, you know, the co-inventing is like, you know, we learn, and if we learn something, we share, so that other people get some, you know, input to evolve as they move along. Yeah.
Thank you, Dr. Thana. Architect Mum, your response to that, I'm sure you have an experience too in your office, so maybe that can also help the whole team to actually move forward on this one. Thank you.
Yeah, well, we are actually facing some of these issues now. In fact, I believe one of my workers are already facing a positive as of 2 days ago. So yeah, we have to really work fast. We don't know how else to do it except to quickly implement the SOPs. I mean, constantly implement the SOPs as much as possible. Every other day, the work on site is being checked. At the moment, in my site, as far as I'm concerned, of my experience, I do hope many others will do the same thing too. That's how I see it.
Okay. Datin, an overview, what have all the three panelists have just spoken, and maybe before we go to the participants' questions. Thank you.
This is uncalled for. I'm not prepared, but in my mind, I'll give you an overview as usual. Okay, I think, you know, I recall what our DG of Health says about the whole scenario is that you have to know your enemy, or rather, what is the cause of all these things, which is the virus itself. So, and then knowing the virus, knowing that, then you know what kind of things that actually has to be done to avoid or getting into the cracks of that pandemic. So I think our built environment, in most of the guidelines that we have prepared, I think even internationally or locally, is based on something that had happened, and then you work for it. And the thing is, the guidelines or the standards, or sometimes gets into a rut. You know, people forget the very purpose why it was built, or what was designed, what it was even written. So you only take the wordings or what things that is legally legally mandatory to any of the work, or even in the exercising of procedures, but not the spirit that goes with it. So it has to, again, back to like behavior of people, that it has to be back to school, or rather from the home, how to actually talk about hygiene, talk about, things. So it basically goes back to the social responsibilities of the community and people there. So, but in our current situation is we are combating something that is already built. Hopefully that by going back to understanding or reading, or rather history, okay, but go back to history of going through all our documents that we already have. What is it that we have not actually met that have this requirement, or we face this situation? That's why we decided we're not going to reinvent, we're going to enhance whatever we have, because that will not give a bit more burden to others. But and recall, we have to go back in time again. Where did we go wrong? Okay, I think it's the same thing with the pandemic world over. We have learned from previous pandemic, and yet human tends to forget. And so I think philosophically it's about going back and recall and putting back in place, hopefully, the spirit of knowledge, of knowing, or the SOPs can be actually integrated into the culture, so it becomes part of our culture. Then maybe it will reduce a bit on this. Of course, we cannot say 100% that it will go. And I think Japan already said that we are going to be inhabiting this world with this virus, so we have to work with it. And there's so many webinars out there that says, well, it has to be like a flu now. Right, it's like a flu, or like or mosquitoes and the dengue, which is part of our life. They have to take it that way. So I guess if we follow the SOPs, and we have to integrate in our day-to-day, whatever material you use to combat those things, then that say locally or otherwise can be covered. I think that's generally what I can say about the situation. Thank you.
Thank you, Datin, for that words. I think that is actually a summary that shows that we need to be living symbiotically with this virus from now on, and vaccine is just a way to actually resolve portions of it. We have got two questions more coming in on the board, but I think this one maybe is possibly directed to Architect Mum, because she will be heading as a project director to actually move forward on this, making it a MyCG. So the question comes from Chi Wai Ying. Dear panelists, has the Institute engaged with property developers and contractors in formulating the 13 ACGs? These two stakeholders are a critical part of the real estate supply chain with regards to product design, construction processes, and property maintenance. Thank you. Maybe they're talking about the master builders and also the radar. So, Architect Mum?
Yes, thank you, Chi Wai Ying. Thank you for reminding. Yes, the property developers, the contractors are already in our list, and we will definitely invite them to be part of our team. And we do hope they will join us, as different built environment stakeholders have different experience and point of views to share. Yeah, we really need to bring them along. Thank you.
His follow-on question is about to understand the challenges faced, and I think that is considered to be very important as well. Yeah, sorry, yes?
Yes, definitely, definitely, yes.
Architect Tony, from your Hong Kong experience, right, when you work with the property developers and contractors, what would you expect the major stumbling block so that we can actually, apart from what we know thus far, will be things to be watched out in order not to wash out our ACGs that we have just implemented for the benefit of people and also betterment of human beings? Thanks. You're muted, sorry.
Yes, I keep forgetting to unmute myself. I think the thing that the property developer is most interested in is number one is a quick turnaround. I think this is how they get the money in Hong Kong, quick turnaround, and so that it also doesn't affect the real estate price for that. So any prolonged discussion about policy changes, regulation changes is actually a risk to us. But also at the same time, if nobody's coming out to work, nobody's going to invest into the real estate in terms of buying their own home or having extended business like in offices or like in factories, and they also don't have enough business. So I think there's an incentive for them to understand better how we as designers, how we as architects and planners are looking at how it's changed. So I think there's a two sides of a story that we have to understand before we can work with the developers in that respect.
Okay, Dr. Thana, from the Thailand experience on this.
Well, I think for the large corporations, I think they are well-to-do, and then they're quite ahead in terms of doing different measures to make them safe in terms of the working environment, and also part of probably the kind of the marketing, the kind of the public image that they have been that to show that they have the advantages of taking care of the factors that people are afraid of. But I think for the problem might lie into those small enterprises, small companies, small group, or maybe like those SME contractor and stuff, that this group rely hard mainly on the kind of cross-border labors, which now surrounding Thailand, they are, we are quite alarmed. In these past weeks, we have cases that people sneak through the border and brought in that are infected, and this scare the whole lot of people. And it's kind of when there's the workforce sneak through the border with the virus, then they didn't, the authority didn't detect them until they attend parties and concerts and going places, and then they got sick and went to the hospital and tested. And now that in this past week, Thailand has been tracking down, luckily with some kind of this kind of online check-in and stuff help us to track down the risk group. These are as I mentioned, the big corporation are quite well to do, and this was reflected in our guideline that Tony mentioned earlier in his introduction, that we are more looking for the usefulness of this guideline toward the vulnerable group, rather less more than the well-to-do group. Like when we discuss about when we have to help people work at home, how they can manage their spaces at home, those in the limited space dwelling, the residential space. These are groups that need more help, but those who are in the large single family houses, they don't have any problem turning their home into working spaces and stuff. Similarly, in the construction and real estate industry, there are also like classes of high risk and the low risk and the well-to-do, and I think we need to encourage those well-to-do to help others in the smaller businesses. And I think if we can, we as the institute can be the agency to bring this connection and bring help across to from the well-to-do to the vulnerable one. Not only in the real estate businesses, but also in other aspects of life in the urban environment.
Yeah, thank you. Architect Mumtazah, I'm sure you're going to have a big task ahead for 6 months to actually assemble and also to collate all these meetings. So if I were to ask, what would be your first, even though you have shown it on the slides, when would you expect the first of such meetings to be held? Thank you.
Started with PAM members, get them to join us. Remember, this is volunteer, yeah? This is a volunteer project. So we do this together. You know, our hashtag, kita jaga kita, we look after ourselves. So it is actually important. So invite PAM members to join us. We need more brains, we need more heads. You guys are really wonderful people, let's join. And then we will definitely invite the various other stakeholders. Actually, I prepared a letter of invitation to all the various stakeholders to officially invite them so that they can disseminate among their members. As what she mentioned, the developers, the contractors, industrial designers, maybe, a lot of things. In fact, remember a few weeks ago we had the World Toilet Day talk. People are already talking about the the new types of design for due to the impact of COVID-19. There will still be some. I can't imagine how if you cannot touch your WC, but I don't know. Maybe somebody will have to figure out, because touching SOP is quite critical when it comes to COVID-19. So yeah, we're going to invite more people. The more brain, the better. And definitely we need to have everybody to be with us. So yeah, just to share with you, quite interestingly, a couple of weeks ago, I was just asking a doctor, this is, how is your patients nowadays, now that there's COVID-19? She was saying that 75%, I lost my patient. I don't have my patients. There are no patients coming to the hospital. Hospital is very quiet. Not many people got sick. And I asked her why. I guess maybe they were not going around doing stupid things or something like that. You know, everybody is trying to keep themselves healthy at home. I said, yeah, that's true. But unfortunately, there are a vulnerable group who need to be outside, who need to socialize, and that's part of their life. We do have some special needs people who become almost crazy, mentally depressed for not being able to be outside, for not being able to socialize with people, for not being able to see friends and stuff like that. So mental depression is another matter to look into. But anyway, that is just something to think of. And then something that we can consider, if you look at the hospitals nowadays, how people stand in line is different from how people stand in line before. Even the bus stations or the public spaces, there are more people waiting outside the building than people waiting inside the building.
Yep.
So that is really something that we need to look at. Probably has less interior spaces and more exterior spaces in Malaysian context. Yeah, because we are a tropical country, we don't have snow, so it's okay to be in a covered space, not so much outdoor under the sun. It's just too hot to stand under the sun. But well, it can kill the virus if you stand under the sun, but you need more natural ventilation inside the building. So that's how I see it. Thank you.
Okay, thank you very much. I think there's one request here because talking about CSR, right? Hopefully by the end of all these ACGs, would that be also be translated into Braille to make it more inclusive to all? Because that will actually be very universal and the first of its kind in the world. So if that is, then the answer would be yes.
I would love to do that. Yes, you know, I am an advocacy on the disability and special needs. Of course, thank you for reminding that, and I'm sure we'll have to also do for the blind, where we can have it in audio format, hopefully.
Or even rewriting. Anyway, just to have every participant in the room, as well as to please advocate this to all your friends, whether you are directly involved or indirectly involved for built environment. The form which Architect Mumtazah has been wanting to share is on the chat box. It's the PAM MyCG form. So please disseminate and also answer that. And I think it's about time that we can end the program. If there's no other questions or any of the panelists would like to highlight anything. If not, I would like to go around the panelists starting with Architect Tony, and I will be finishing off with Architect Saifuddin being the Zone B Vice President before we close the session. Architect Tony, any last words before we close the session?
Yeah, thank you very much. First of all, I think the plan that Mumtazah put together is very comprehensive. Thank you very much. So such good coordination. And also I look at the participation of the members. There are plenty. So I'm very hopeful, and that it's going to fly in Malaysia. The MyCG is going to be a very good example for us to take to the other countries and tell them what good work you've done. So thank you very much for getting it kick-started. Really appreciate it.
Thank you. Dr. Thana?
Yeah, I think we need to thanks PAM so much. It's like giving us hope. They respond so quick. We didn't really prepare for this, first roadshow to happen. But as I said, PAM has been very proactive with Arcasia throughout. At least in the past 4 years that I have direct experience with Arcasia. And I think what Mumtazah has shown us is aligned with the process that we have done in ACSI and the AEA to kind of emphasize the idea of co-inventing, that we are not the expert ourselves to give direction or give guidance to others, but we need to be the agency to bring in different parties to participate. And I think the outcome will belong to everyone, not by an institute or any group or committee. Congratulate PAM and thank you.
Architect Mumtazah?
Jom, join us.
Okay.
Welcome. That's it.
Datin?
I think we started for very much earlier this year. I think it's like what Mumi says. We come to the culmination 2020. It's about this whole thing. So we have some what do you call it? Silver lining across. So if it, virus or vaccine or no vaccine is nothing, so we still have to go on living, and we hope we can still live, work, play as usual, and having less of all that. We can actually live with the new SOPs into our environment. Thank you. Yeah.
Architect Russell, I have not forgotten you, because you are the chair of CSR, so I'll leave the best to the last to you. So because all your team is doing the work. So now I would like to hear from you last words before I pass to Architect Saifuddin.
Yeah, I think now is not the conclusion of this webinar. I think it is a beginning of Malaysia way forward. I'm congratulating that Thana and Tony, they have done a good job with Mumtazah. Actually, that very comprehensive plan, I noted Mumtazah's presentation. I think our ACGs are in very safe hands. I think you will modify it according to your context, people, and the place. Actually, that we have to work it out in a way that, because architects are more promoting social interaction rather social distancing. So we have to find a means to get use of these guidelines and make livable, interactive society in a modern way, new new normal condition. I am wishing PAM, and I'm thanking the PAM came forward first and initiate this project. Probably the other countries also could be follow, then only our ACSR work implementation is so important. So I am considering this webinar is not a conclusion, it's a begin. Thank you.
Thank you, Architect Russell. Now to Architect Saifuddin, our Vice President of Zone B for Arcasia.
Thank you, Mus. I'd like to congratulate PAM Committee of Social Responsibility for taking this initiative. Maybe on behalf of Arcasia office bearers, what we have done actually is a template. As you all know, Asia is so big. We are so diversified in terms of culture, social, and also the environment. But what most important is PAM should engage with all the stakeholders. I noted it's stated there, and also one of the what they call the guests has also mentioned the same thing. To move forward is what they call get the whole thing in place, because even as I mentioned earlier, even in Malaysia there has been a lot of seminars and talks with regards to COVID-19. Various SOP has been done, but what we need is actually to combine everything and have one as a guideline. Again, congratulations to everyone who's involved, whether it's Arcasia or even at PAM. Move forward from here. Thank you.
Thank you very much, Architect Saifuddin, for that compliments, and also for us to be more optimistic, because I think architects needs to create optimism out there to ensure that we can assist the world to move forward from this pandemic and COVID-19. I think with that, I saw a hand raised under the attendees. I'm not sure why, if you can actually post in your question later, maybe you can join us into the team committee, then because now we can do online. So I think that is much better. I think the person is Roshatima. We take note of that, and I think as part of the systems of webinar, I think Salam, you're going to organize the photo session, right?
1, 2, 3. Okay, thank you guys.
Okay, thank you very much, participants. Thank you very much, panelists. You all have been a wonderful bunch of people, and also special thanks to our visitors from Arcasia, Architect Russell, Architect Tony Wong, and also Dr. Thana. And also thank you very much, Architect Saifuddin, for graciously opening the session. And also to all the participants, do sign up, and especially for Rosatima, sign in and help us to build this localization of ACGs forward. We got 6 months, we have about 13 ACGs, so I'm just wondering, is it going to be parallel or what? So
parallel,
whatever
parallel.
it is, yeah, whatever it is, yes, whatever it is, we can do it, inshallah, and everybody work together, we can do it. So with that, I would like to wish you all a very good afternoon, very good evening, wherever you are. If you also from somewhere else, very good morning. And have a nice weekend, have a nice Saturday, and as what the term in Malaysia here, kita jaga kita, we watch ourselves and we take care of ourselves too. So, okay, bye for now, and salam all together. Bye.
Bye.
Goodbye.
Bye.
Okay.
Bye, goodbye.